My name's Richard Selwyn. I'm Assistant Director for Commissioning at Suffolk County Council. I've just come out of the session around Children's Services Next Practice, where we're looking at creating a moonshot in terms of radical change and innovation for children's services in the future. So this is the concept of a Google moonshot where can we be innovative, can we be radical about how we're thinking? If you look at where we are in children's services at the moment, there's been a period of investment over the last 60 years. But then 10 years between 2010 and 2020 of cuts. And at the same time, we've got digital revolution going on across the world. We've got cultural revolution in terms of the relationship between the state and the citizen. And all these things are coming together. So we've got the ingredients for innovation, radical innovation in children's services. There are some themes around sort of understanding families better, using data better, being able to shape and deliver our services in a better way because of that. But also themes about how we respond. So instead of a system which pushes people away, can we have a system that reaches out, that understands need in advance of it developing, reaches out and supports people? Can we develop ways of having single points of access to services, for instance, that then funnel the individual through to what support they need. So rather than thresholds guiding that, have a conversation and then find the resource and the system to support that individual. There's always the debate about whether early help really works and whether we should be investing in it, whether we should be going for statutory minimum. I think the resounding emphasis was we have to be investing in early help, we have to be supporting families. We just need to find new ways of doing that. We need to start drawing on that blend of community and public sector services. We need to start developing digital services more. It's what our young people expect now. And also working better with universal services such as schools, early years, pharmacies. So I think this is critical. This is the fundamental about the future of children's services. So what's the model that we're going to collectively want to develop? How are we going to work on different parts of that? How are we going to collaborate to develop up new models for children's services? What works best? How can we kind of galvanise the country to come up with a new way of working? Because at the moment, with the cuts going on, there won't be enough money for the current system design. So I think when you look at what every partner is trying to do locally, be that the police, health partners, the local authority and us, we're all trying to improve the resilience of the individual and the family so that they don't need to draw on our services in the future. And yet the science behind developing that is a little behind the times. So that might be a priority area for us to work on to help families, help them in advance, but also reduce the demand coming into our statutory services.